So some info about the structure of the organ would have to be the skin, which has 3 layers. The third layer is made of fat and connective tissue. The second layer has a tough connective tissue of hair follicles and sweat glands. And the first layer provides a waterproof barrier, which also contains our skin.
We have 2 pathways for processing touch. Our sensory pathways, which receive the facts about touch, such as pressure and vibration. Our primary somatosensory cortex is the first region to get the experience of touch, analyzing information through stages. The second pathway processes social and emotional information.
Some accessory glands, organs, and structures for the touch would have to be fingers and the skin.
We use touch to gather information about the world around us, as well as establishing trust and social bonds. Positive touch is crucial in an infant's development. Touch is also important for our survival, letting us know what causes us pain or harm. Touch receptors in our skin send information to the brain. We have our thermoreceptors, which detect heat, our neuroreceptors, which detect pain, and our proreceptors, which sense position.
Alright, so if you look here, we have a pretty basic diagram of the sense of touch. The most common place you touch things with is your fingers. Let's say you use your index finger and touch the point of a sharp nail and it hurt you pretty bad, I guess. Well, the reason this happens is because you have a sensor that feels the sharpness called the nociceptor. The nociceptor sends information to the brain. The signals go through a series of order nerve fibers, which then comes to the spinal cord containing the anterolateral system. After, the neurons lead through the thalamus to the top of your brain, which is where the primary somatic cortex and the somatic association area is located. After it reaches your brain, your body tells you what you are touching. And that's basically what this diagram is explaining. Okay, so I'm going to be comparing the touch sense and the taste sense. So touch is the gatekeeper sensory system designed to tell the body what outside objects do to the skin through the texture and through the pain. Well, taste is a gatekeeper sensory mechanism designed to test food and other substances before they enter the body. Things that taste bad are potentially harmful, and things that taste good are potentially useful for the body, but that's not always true. Okay, and the amount of cortex devoted to a body part is related to the sensitivity of the body part to touch and pain. The main difference between touch and taste is you can distinguish an object with touch, whereas for taste you can only get a flavor, and it doesn't always work out with an adamant object. And that concludes our presentation. Thank you.